Hello, everyone. My name is Aisha Langford, and I'm the founder of Funeral Syllabus, where the motto is make a plan, keep the peace, leave a legacy. Today, we'll be talking about palliative care with Safiya Steward, a board-certified adult and geriatric primary care nurse practitioner. She has more than 16 years of experience providing care to older adults and patients in long-term care, assisted living, and home settings. Thank you for joining me, Safiya, and we'll just get right into the questions. So, can you tell us a little bit about your professional journey and what motivated you to go into palliative care?
Yeah, so as you mentioned, I'm a board certified adult and geriatric nurse practitioner. I truly consider myself to be a geriatrician, to be quite honest. And I've seen, as you mentioned, the geriatric community in all of the settings. And so I think, especially early on in my profession, I was really surprised some of the conversations that people were not having with people who have serious diagnosis. And I feel like that was really important. And I felt like it was something that the patients and the families, when I sat down with them, they really, really valued. And it really helped them make really important decisions in the future. So I feel like that's kind of how I transitioned to palliative care, is coming from a geriatric focus.
Okay, and people may not be familiar with that term, palliative care. So, what is palliative care and when should someone consider it?
So palliative care medicine is, compared to like cardiology and orthopedics, is a newer medical specialty. And the goal of palliative care is to really work with people who have serious diagnosis to help do two things primarily: symptom management and to help with the stress of a serious diagnosis. People who are receiving palliative medicine are also receiving medical care at the same time from their specialist. And there's really no, even though my perspective and my experience has been a lot with the geriatric community, I've had patients of all ages. So there really isn't an age associated with a palliative care consult. It's really tied to someone who has a serious diagnosis, whatever age that may be.
Okay, and can you give us examples of the types of serious illnesses or health conditions that are good candidates for palliative care?
So, a cancer diagnosis, someone with dementia, emphysema, heart failure, multiple sclerosis, these are all diagnoses that would be totally appropriate for a palliative care consult.
Okay, and how can palliative care improve quality of life for patients and their loved ones? So, for example, I typically think of like pain management when someone's very close to death, but what are some of the other things that you may help with, and how do you help improve quality of life for the patients and their families?
So, that's a really good point. Pain is obviously definitely one of them, but I think about palliative care kind of doing three things. So, symptom management besides pain is shortness of breath. So, again, someone who has heart failure. So, you may be seeing your cardiologist and they may be changing some of the medications to help with shortness of breath, but we may come to the table with additional symptom medication recommendations. And it really helps them improve their quality of life. So if you are really short of breath, but we are helping manage that shortness of breath, it may allow you to continue to do gardening or spend time with your grandchildren. The other part that's really important is that we have more time, honestly, than some other providers to sit and talk to you about the trajectory of your disease process, right? So we're really talking to you about, this is why you're feeling this way, because this is where your disease process is, and this is where it may go. I think the third thing that I think is really, really important is, as we're talking about the disease process and the trajectory, we are engaging the patient and their loved one. And what are your wishes, right? As this disease process progresses, there's a lot of things that a lot of things that medicine is going to offer you, but you get to decide what you want. And I think for a lot of people, especially older generation, that's really a shock for them, that they don't have to say yes to everything that they're offered, that they can really sit and think about, if this treatment is offered, is that in my best interest? Is that something I really want to pursue? So having those goals of care conversations to make sure that the medical treatment that they're receiving is aligned with what their personal wishes are.
That's really aligned with the idea of informed medical decision making.
Yeah.
And so, can you just elaborate on that just a little bit more? So, as you said, I think many older patients, but I think medical patients in general, they feel like if they're offered something, they have to take it. But I think what you're saying is that they have agency and they're able to say no if they want to say no, and that's okay. And
Yes.
that their doctors and their family shouldn't really pressure them to do something that's not their own goal or their own value or their own preference. So, how do you help people feel empowered that saying no or not right now is a real option?
Um, just really supporting their decisions. One of the things that I say to my patients and my families all the time is, I am not here to make the decision. I am not here to change your mind. Because depending on where my consult may come from, if it's coming from another provider, when I was doing inpatient palliative care consults, if it was coming from a provider in the hospital, their goal may be different than what my goal is walking in that room, right? So their goal may be for me to help create a change that aligns with um, a certain outcome that the provider wants or the hospital wants. That's not my goal is to come in and help you make informed decisions and to have your back because I've had it both ways. I've had situations where the patient doesn't want certain things and the daughter or the son thinks mom or dad should pursue. And I have to say to them, hey, we live in a country where you have autonomy. And if you're not going to be the one who's going to endure this treatment or this workup or this imaging, then we have to really support them. And I've had some family members who will still kind of try to push mom or dad to do what they don't want to do. And then some that'll say, you know what, you're right. You're really right. I'm coming from a place of I'm scared about if they don't get this treatment, what that means for them. And so I'm really just kind of being their coach and really supporting them and helping them make that gap with their families. If there's a knowledge gap, if there's a goals alignment gap, and just trying to encourage the patient and the family to say, hey, they have the right. They have the right to make these decisions.
Right. And it's so great for me to hear you say that. I do research in medical decision making. And one of the things that when I'm giving talks, have to remind families and loved ones and friends that even though we all care about our family members and our loved ones, that it's really their journey. And we
Mm-hmm.
have to practice being supportive, but sometimes shutting our mouths and not trying
Mm-hmm.
to project or kind of force our own thoughts, which really a lot of times come from a place of people being scared and
Yeah.
really caring because they love their loved one and they want them to be around as long as possible. But the choices I may make for myself are
Mm-hmm.
maybe different than what my mom would want or my brother would want or my husband would want. So we have to exercise constraint and
We
really just
do. We
do
really
active
do.
listening and to be supportive, but to acknowledge that that person's journey is their journey and they're the ones really driving the car or navigating where they want to go. And it's really their choice for us to support.
Absolutely.
So, speaking of palliative care, like I said earlier, I used to think that was only for people who were in a lot of pain or really, really close to death. Um, but what are some of the common myths or misconceptions people may have about palliative care?
That you hit the nail on the head there. So that is the biggest one. That palliative care is care at the end of life, and it's not true. So palliative care again is for people with serious diagnoses who are actively seeking treatment. So it's management of pain or shortness of breath or nausea and vomiting, constipation. And so I will be extremely honest with you. That is the biggest struggle in what I do on a day-to-day basis is that confusion from physicians, from fellow nurse practitioners, from the physical therapist, from the bedside nurse. I've gone into many a room and the nurse is like, oh, wait a minute, are they're on hospice? I didn't. And so there's that undertone of it being at the end of life is because people are confusing palliative care with hospice, which is an awesome service. It is a service, though, for people who decide that the burden of treatment is not worth it anymore. And so they want to focus on comfort. So there's a lot of overlap, which I think is where a lot of the confusion comes from the symptom management, the goals of care. But the major distinction is that hospice is when you decide that you don't no longer want that medical curative treatment. And palliative care is when you still do.
Okay. And you're helping people manage their symptoms and their journey when they are choosing to keep going with treatment.
Yes. What we always say is all of hospice is palliative care, but not all of palliative care is hospice.
Okay.
And so it is really that distinction when they qualify for hospice and they also no longer want certain medical curative treatment.
Okay. That's very helpful. And so I'm just curious. So how does someone access palliative care? And what questions should they ask their healthcare providers if they want to learn more about palliative care options?
So all good, to be quite honest, all good primary palliative care starts with your primary care provider or your specialist, right? So they're helping manage symptoms, they're helping talk to you about your disease process, your trajectory. But as things get more complicated, as pain gets more complicated and they need the support of a specialist, that's where a palliative care consult with a specialist who's trained like myself is really helpful. There is a website called gopalliativecare.org. Highly recommend that people go on there. You can put in your zip code. It'll find the palliative care providers, teams in your neighborhood. And then on there, there's also I think it's like 5 or 6 questions, yes or no. You type them, you just hit the circles really, and they'll tell you like, hey, based on the answers, like you probably would benefit from a palliative care consult.
Okay. And can you repeat that? I'm going to put the website in the show notes, but can you repeat the website one more time?
Absolutely. Getpalliativecare.org.
Okay, great. Well, those were my main questions. I think you hit all the high points that I was hoping to get from this interview. Is there anything else you'd like to share before we wrap up?
No, I don't think so. I think the biggest thing is just patient autonomy is really important. And I love that I get to work with patients and families and help them decide what they want, because that having things align with what your personal wishes are and what your healthcare decisions are is so important. And believe it or not, even though sometimes, siblings, children may not agree initially, as the patient stands their ground, I think the loved ones really come around, and it really helps. It really helps take that weight off of them to say, you know what, they decided it. They decided it. I'm going to support their decision and I'm going to be here by their side. And they're still going to get really good care because they're going to still get very good symptom management to ensure that they have good quality of life.
Okay. Well, thank you for your time and expertise.